Hi, thank you for joining us. My name is Dr. Gina Perez. I am a neurologist and a neuroimmunologist, and today we're going to talk about what it means to age well with MS. There's a lot of helpful information and very powerful information that we're going to share, so let's get started. Just 20 years ago, most people that live with MS were around age 45, and our goal of MS treatment was to stop relapses. But now, our patients with MS are living longer, into their 60s, 70s, and beyond, and they are experiencing MS differently. Almost half of people living with MS are 55 years old or older, and more people are now diagnosed with MS later in life. But then we don't know as much about how aging impacts MS, how disease activity is different as we get older, and related topics like when do we stop disease modifying therapies, or how can we separate MS changes from normal aging. In many Hispanic families, health concerns are often kept within the family, and older adults may avoid discussing new or worsening symptoms to avoid burdening their loved ones. So, this cultural emphasis and strength and privacy is something that I admire, but also can delay care, especially with a disease like MS that is unpredictable and is not always visible. So, as a result, Hispanic patients living with MS can be diagnosed later or can not receive the care that they need. So, I want to encourage you to bring up your concerns to your neurologist, to your provider, so that you can get the help for the symptoms that you might be experiencing as you're aging with this disease. Underrepresentation in MS research also means that there's less culturally informed treatment guidelines and less understanding of how MS progresses in Hispanic patients, especially with aging. So today I want to share with you some things about the importance of staying ahead of preventive care, managing symptoms and the whole body health, and planning for disease progression. So preventing care or monitoring is important. So what is the importance of routine preventive care? Well, early detection creates the best outcomes for new health challenges. Increasing healthcare awareness and accessibility helps people with MS to embrace preventive care and routine screenings. Language and health literacy barriers may limit Hispanic people living with MS and their understanding of treatments and interactions with doctors. So, but I want you to know that you can ask for language services, family or community health workers to navigate the healthcare system. In some Hispanic communities, chronic illnesses may be seen as a source of stigma, shame, or spiritual weakness. And this can lead to hiding symptoms or avoiding care, or also can lead to experiencing social isolation. I want you to work with a culturally competent doctor and regularly communicate new issues so that we can help you. Comorbidities, including comorbidities, contribute to MS fatigue, progression, and other symptoms. So it's important that we prevent and manage comorbidities through vaccines and routine care to stay in control of health. Disease modifying therapies: when and what to start, stop, or adjust. So we know that starting a disease modifying therapy early after the diagnosis makes a difference. This reduces disease activity, delays progression, and limits the inflammation of the central nervous system. However, inflammation and relapses naturally decrease as we age, and the risk of side effects from the disease modifying therapies increases with age as well. So it might be safer for an older person with MS to stop the disease modifying therapy. So talk with your neurologist, talk with your doctor. We might start having this conversation as you start your 60s or your mid 60s. Something else to keep in mind is that Medicare may no longer support copay assistance, or out-of-pocket costs of the disease-modifying therapies might be too high due to the change in insurance as we age. So Some Hispanic individuals may face additional financial stress or may not qualify for certain benefits due to the residency status. So I want you to know that there's discount programs we can explore, payment programs for pharmaceutical companies and other healthcare nonprofits that can help you. Diet and exercise can help for life longevity. So, brain reserve protects the brain and can be built over time through continual learning, life experiences, and brain games. Regular exercise, like cardiovascular exercise, eating a diet that is high in vegetables, high in omega-3 fatty acids, can really help in promoting healthy aging. It can help with brain health. This can then help with the disease as well. Prioritizing getting quality sleep, minimizing stress when possible, and avoiding smoking and drugs can also help with the disease itself. A healthy gut microbiome can improve MS itself. So we know that the gut microbiome is highly associated with our immune system and is associated with MS as well. So keeping a healthy gut microbiome can help the disease. So I suggest that you eat a diet that is high in fiber, a diet that is high in omega-3 fatty acids, as I mentioned, including fermented foods. That can also help with our gut microbiome. Let's talk about managing symptoms and whole body health. Early signs of disease progression and symptom changes can definitely affect this. MS relapses generally decrease as a person ages, and progressive disability becomes more pronounced at 55 and older. Around 45 or 55, it's hard for a doctor to determine if the health change that you're experiencing is due to MS or just the regular aging. And this highlights the importance of attending annual medical appointments and good communication with doctors. Common MS symptoms that are also related to aging are cognitive changes, incontinence, mobility change challenges, or difficulty sleeping and fatigue. So it's important that we manage our comorbidities. What is a comorbidity? A comorbidity is having another health condition in addition to multiple sclerosis. Common comorbidities in people with MS are diabetes, high blood pressure, high cholesterol, lung disease, and depression. Comorbidities like diabetes, hypertension, and obesity are more common in Hispanic patients than other groups and may make MS related disability worse with age. These comorbidities can all be improved with lifestyle changes, healthy diet, regular exercise, and medications. In the Hispanic communities, mental health issues are often under addressed due to stigma and lack of culturally competent doctors. It is important for us to know that when we live with MS, there is a higher risk of having depression, anxiety, or other healthcare problems. So I want to encourage you to bring this up to your healthcare provider because it's something that you can get help with and make you feel better. Preventing or treating comorbidities overall can reduce progressive disability. There are immune and hormonal changes as we age too. Aging affects the immune system, so the response to vaccines is less. There's going to be a higher risk of infections and even cancers as we age. So healthy choices help people with MS stay protected and responsive to treatments and immunizations. In MS aging, older immune cells lead to less attacks and there's less disease activity as we age. However, there is a higher risk of disease progression. So while there are less relapses as we age, there may be more symptoms like brain fog or fatigue, can leave you with more chronic symptoms and more disabling symptoms. Hormonal changes can affect nerve protection and multiple sclerosis. So right now there's a lot of interest because we want to know is there a role on estrogen therapies? Can this actually help with the disease itself? Is there less neurodegeneration with hormonal therapies? This is something that we don't know yet, but there's a lot of interest and a lot of research trying to explore this. However, we do know that symptoms like hot flashes during menopause can bring up some MS symptoms. And we know that a lot of women, once they're experiencing menopause or the years before or after menopause, there's more MS symptoms too. Symptoms like sleep disturbances, mood changes can worsen existing MS symptoms as well and can affect disease progression. In some Hispanic cultures, menopause is seen as a natural part of aging and may not always be treated medically. And this cultural views may lead to underreported symptoms that could be helped with treatment. But I want you to know that definitely we know now that menopause can affect your symptoms, can make your symptoms worse, or can even make progression more apparent. And I want you to know that sometimes therapies for menopause can help that. So there's a lot of interest in hormonal replacement therapies, estrogen or progesterone or other things that you can discuss with your provider, and this can definitely help your symptoms. So I encourage you to reach out to your MS doctor as well to a gynecologist and your family medicine doctor to address this. And this not only affects women, it can also affect men. This is called as andropause or the male menopause. And this is the gradual decline of testosterone levels that many men experience starting in the middle age. And common symptoms include fatigue, decreased libido, sleep problems, and loss of muscle mass. So, in men with MS, the slower testosterone can worsen cognitive function, mobility, and can accelerate disability progression. So, I would like to encourage you to, as Hispanic men, to reach out to your provider so that you can discuss this as well. This is something that can affect you as well. You can explore symptom relief strategies. So there's integrative medicine that can be culturally respectful. It can align well with many values of the Hispanic communities when we're introduced them appropriately. A lot of our Hispanic families already have some home remedies and traditional healing practices that are passed down through generations. And I think that this is great. I just encourage you to bring this up to your provider so that we know exactly what is being used. Sometimes some of these natural remedies or herbal supplements can be toxic as well. So I encourage you to discuss with your neurologist, with your providers, that we make sure that everything is aligned and we're not having any problems with the therapies. Let's talk about planning for progression and long-term support. So when we're diagnosed with MS over age 50, there is a higher risk of having progressive MS. But also when we start having MS even earlier when we're younger, as we start aging and we start our mid 50s and 60s, there is a higher burden of having progressive MS. And this is because the brain volume naturally decreases with age, and this can uncover previously masked symptoms which present progression itself. So I want you to be aware about this. Also, I think that you should be cautious when receiving an MS diagnosis as an older person because sometimes MRIs in older individuals may show white spots that frequently are misdiagnosed as demyelinating changes. Sometimes these white spots can be caused by many other things like high blood pressure, high cholesterol, diabetes, migraines, or many other conditions. And it can be hard for a physician to difference the spots caused by aging or the small vessel disease or multiple sclerosis. And this is why it's so important that you're consulting with an MS provider or a doctor that has expertise in multiple sclerosis. It can help distinguish between these two conditions. We also know that MS is unpredictable and MS affects everyone differently. It's a different disease for each individual. However, there are some factors that we use as clinicians that can help us determine who has a higher risk of having more progressive MS and who has a lower risk. So, a few things that we use in the clinical practice to help us determine who has a less risk of having a disease that is more progressive is patients that have fewer relapses in the first few years after the diagnosis, or patients that have long intervals between relapses and they have complete recovery between the relapses, or patients that have sensory relapses mostly, like tingling and numbness, patients that have optic neuritis, or patients that have a normal neurological exam 5 years after the diagnosis. These patients tend to have less progression as they're aging. On the other side, patients that tend to have a more progressive course are patients that start the disease with tremors, lack of coordination, difficulty walking, frequent attacks early, or incomplete recovery between attacks. And these are all things that put you at higher risk of having a disease that can be more progressive. There's economic factors in some Hispanic communities that may limit the access to paid caregiving or specialized long-term care, which can make early planning crucial. Along common aging experiences like incontinence and fatigue, people with progressive MS might also have challenges with speech or swallowing. So it's important to be aware about this because you can work with a speech pathologist, you can talk with many other providers in your healthcare team, like occupational therapists or physical therapists when there's physical limitations, and this can help with the symptoms that may appear as we're aging and we have more progressive MS. Hispanic families often provide informal intergenerational caregiving, which can be very supportive, but may lack the training in managing progressive MS. So I want you to stay connected with your family and your caregivers for support, and this is essential. It's essential for our families to keep this in mind and plan for future possible outcomes. And it's important to consider accessibility tools for safety and independence. Some studies suggest that Hispanic patients living with MS may experience faster disability progression or different symptom patterns as compared to other ethnicities. And it may be the longer someone has MS, the more chance of developing mobility issues because injury does build over time. So tailoring programs to meet economic and geographic needs helps reduce disparities in access to care and technology for Hispanic populations. I want you to know that you might stay active and independent with the help of assistive devices, things like canes, walkers, motorized scooters, wheelchairs, or complex rehabilitation technology. And sometimes pride or fear of stigma and the belief that using a mobility aid can be like giving up, but can lead to some Hispanic individuals to avoid using devices. But I want you to know that this is not the case. Truly, this is something that can really, really help you. And education from a trusted community leader on a peer role model can help normalize and encourage the use of devices. And I think it would be good for you to work with a culturally competent physical therapist or occupational therapist for an evaluation of which device will work best for you. There's also home modifications and repairs of the house that can benefit everyone that lives in the home and can avoid disrupting your mobility. Some states offer tax credits for some modifications for disability, which can help with the long-term costs. And you can contact a certified aging in place specialist in your area to learn more. And also, there's community health centers, social service agencies, local nonprofits that may offer free or sliding scale programs for equipment loans, home modification assistance, or caregiver support.